welcome to the NewsX Sunday Guardian Roundtable. Well, today we're going to be discussing something very basic and very simple. You know, the pandemic is here. We also know the situation is not getting any better. In fact, it's worsening, especially in the metro cities and the urban areas. Delhi in the national capital seems to be rising. Bombay, we don't know whether Maharashtra has peaked or not, but has certainly seen the highest number of cases. Given the fact that there is a shortage of beds, given the fact that the Delhi Chief Minister is predicting as many as 5.5 lakh cases by the end of next month, what do we do? How do we, because I don't think everybody is going to be getting that hospital bed. Even if you do, there are various horror stories doing the rounds. We're not really going to go on the politics of it, whether we were prepared, whether we are going to be prepared, because, let's just basically focus on things that we can do, something that is in our hands, because the rest of it is in the politicians' hands. So I have with me a panel of doctors, medical experts that are going to be guiding us through our symptoms, what to do, how should we self-medicate at home, because a lot of that is going to be happening now. If we don't get the beds, should we go rushing to the hospitals and add to the already overburdened system at the first sign of, flu, temperature, cough, or should we actually self-medicate ourselves? When do we panic? These are some of the questions that are going to be answered on the panel today. Joining me is Dr. Romel Tikku. He is the Assistant Director of Internal Medicine at the Max Super Specialty Hospital, Saket. I have with me Dr. Manish Bajal. He is also the Director at the Institute of Laparoscopy, Endoscopy and Bariatric Surgery at the Max Super Specialty Hospital, Saket. And Dr. Rajiv Parekh. He is the Chairman, Department of Vascular Surgery at the Vedanta Medicity Hospital in Gurgaon. Dr. Tikku, I'll begin with you first. To answer, let's just go first with the basics. What do we do, when we sense some mild symptoms? I don't think everybody should go rushing to the hospital and add to your burden. So what would you advise?
See, most of the patients actually will have mild symptoms, or they might be asymptomatic. Actually, 80% of the disease is mild or asymptomatic. So they might have mild fever, mild body ache, headache, some sore throat, for which they don't have to panic. They just have to get in touch with their doctors. At home, they can have a tablet of paracetamol, maybe an anti-allergic tablet, and get in touch with their doctors. They will guide them as to what they have to do next. Now, the people who are at high risk, 60 and above, the elderly, and the ones who have chronic medical problems like diabetes, heart disease, hypertension, cancer patients, immunosuppressed patients, they are the ones who can get into complications. Even if they have a mild illness, which is, say, fever around 100, some sore throat, some cough, they are the ones who should be taken care of. Again, the mortality is high in the elderly and in such patients. So we have to be very aggressive with them. We don't have to ignore their mild symptoms. We have to get in touch with the doctors and decide what is to be done. Maybe they don't need a COVID test at that point of time, but we'll be more aggressive with them. We'll monitor their health. The things which such patients need to monitor at home, or even otherwise COVID positive patients, what they need to monitor at home is basically they need to check their temperature, pulse, and oxygen saturation. There's a pulse oximeter, which you just attach to your index finger, and it shows the pulse rate and the oxygen saturation. If the oxygen saturation is less than 94%, then it should raise an alarm. If your heart rate is more than 110 per minute, if you are breathless, if you have chest pain, if you have blood in sputum, if you are confused, disoriented, or there are bouts of unconsciousness, severe abdominal pain, persistent fever beyond 101 for 72 hours, these are bad signs. This means that you need admission, and you don't have to basically wait for all these symptoms. As I said, if your saturation is dropping less than 94, your heart rate is more than 110, and you have some sort of fever, that is the time to get in touch with your doctors. They will guide you as to what you need to do next. Do you need hospitalization, or what sort of intervention is required at that point of time? The ones who need hospitalization, again, we have to make sure that they get a bed. They should not step out of the house without contacting any health authority or the hospitals, because it's difficult to get a bed especially in the bigger hospitals, whether it's private or government. So there has to be some sort of transparency as far as the beds are concerned, so that people know which bed is available in which hospital, so that they can choose. They don't have to run around when they are sick in that state, when they're having high fever, they're breathless, running around from one hospital to another. I think that has been the issue mostly, and that's why people are scared when it comes to COVID. There is a lot of panic right now because people feel if they fall sick, if they have COVID, then they won't get a bed. Most of the calls which I get in today's day and time is regarding hospital admission. All of them want to know whether they'll get a bed in Max or not. And everyone wants to get admitted in Max, Apollo, the bigger hospitals, or whether it's the government hospitals, RML, Gangaram, AIIMS. Gangaram is private, Safdarjung. So this panic has to be sorted out. We have to focus on the problems. We don't have to go by numbers. Numbers anyway expected to go up. The way the disease is, we've seen it all over. India is not an exception. And with the kind of healthcare infrastructure that we have and the economic resources, it was bound to happen anyways. It was coming. It was a matter of time. Lockdown helped us to ramp up the infrastructure. But now we'll have to work on all this. We'll have to work on the fact that we have to make people aware of how they have to manage themselves at home if they have mild symptoms. They can get in touch with home care services. Lots of top hospitals are providing that service, including Max, Fortis, Medanta. And that's how we have to go about it.
Okay. In fact, in an ideal world, yes, we shouldn't have to run for beds, but since we do have to, it's not an ideal world. Dr. Parekh, anything you want to add? And also, my question is, what happens after COVID, where, when a person has recovered? What are the things that he has to look out for? Will you totally recover, or, you have some aches and pains that are still there to deal with?
Okay, thank you for giving us this opportunity to sort of sit around and talk about this. This is something extremely important. It has actually changed the way we lived, the way we think, the way we are going to now actually continue to lead our lives, because everything's going to change. There's going to be a new normal. This is not going to be the normal that we are used to, that we've used to sort of been living with. This is going to be a completely new normal. So that is something that we have to worry about. So that's number one. Number two is, I'd like to just sort of put everything together what Dr. Teku said, and I think he's put it up very, very concisely and very eloquently. The important thing is that we have to realize that the numbers are going to increase. Just about 50 to 60% of the people in this country are going to get infected in some stage or the other. Fortunately for us, 80% of these patients will be asymptomatic, asymptomatic, or will not have many symptoms which will require any hospitalization or medical care, so they can be managed themselves. So the important thing that I think that doctors have to try and put across, the government has to put across, and I think above all, it's the responsibility of the media. So I would request the media all across the entire country is to stop terrorizing and stop building up this fear psychosis in the public, that the minute they test positive, they have to start rushing to a hospital, and there are no beds because everything has been taken, and there are no facilities, because no country in the world can look after even 10% of their admissions of their populations. I mean, a country like India with 135 crore people, 10% means 13.5 crore people. There is no country in the world which can take care of or provide hospitalization or medical care facilities for 13.5 crore people. So the important thing is for the media, and I think this is an extremely, extremely important thing, the government has to follow, the doctors have to follow behind them, but the important person here, I think the most important interface between the healthcare infrastructure and the public is the media. They have to come across that there has to be, do not rush to hospital. The numbers will definitely increase, but you have to control hospital admissions so that you don't overrun the hospitals that we have. We have
so how do we control this thing? How do we self-medicate? You want to add to something that Dr. Teku has said?
Yeah. See, the important thing is self-medication comes later. First of all, that fear psychosis, don't rush to the hospital. Self-medication to the point of just basically routine medical care. I think Dr. Teku would be able to, sort of dwell on that as to what medication that that people should take. But simply, taking your vitamin C and your vitamin D and your vitamin B12 and drinking lots and lots of warm water, and just isolating yourself so that you do not either get infected or infect anybody else. I think that is extremely, extremely important. And just monitor your symptoms, as Dr. Teku has very rightly said. The important people are people who are elderly, people who have other comorbid conditions like uncontrolled diabetes, blood pressure, or a heart condition or a stroke or something. These people are in the high risk bracket, and they definitely need to be either under hospital care or at least under medical supervision and care. But the rest of the people can self-monitor your pulse, you can self-monitor your blood pressure, you can check your blood pressure, your temperature, and you can measure your pulse oximeter, the oximetry through a pulse oximeter. All these things are readily available, and this is something And as Dr. Tikku very rightly said, there are these home care packages which Max and Medanta and Fortis and all the other major hospitals are offering, which is telephonic care or video conferencing, through which the patients can actually be in touch with the doctors and the care providers. There can be nurses who can call them every day to find out and inquire how they are. Doctors can actually be on a video conference with them at least 3 to 4 times during that 15-day period. And that is the period of isolation that people have to undergo when they test positive. So don't rush to the hospital. Just look into your symptoms yourself under doctor supervision. And Dr. Tikku will be able to advise you on the medications that would be required to be taken during this period.
Okay, Manish, one is, I've seen a lot of WhatsApp messages saying apart from oximeter and, various medicines that Dr. Tikku was told, in case of a crisis, keep an oxygen tank. I have a whole lot of people rushing to get oxygen tanks. Is that advisable? Secondly, what do you see, people who've recovered from COVID, is there something that they should be worried about? What are the side effects of post-COVID?
Once again, thank you, Priya, for having us over and giving us this opportunity. Now, COVID is there, it's going to be there for a while. So the number one thing what Dr. Parekh and Dr. Tikku has already spoken about, let's take the fear psychosis away. This is going to present like flu in most of the cases. But in today's date, it is every flu is COVID till proved otherwise. So that's where the frequent testing is going to come in. So once we have good number of tests available and everyone is getting tested, we'll be able to isolate these patients. So this is where the responsibility of the patient comes in. We cannot expect the government to come and try and find out each and every person who came in contact with this particular patient and try and isolate. This is where the patients will have to proactively try and find out and remember who they came in contact with, inform those people, so that this spread becomes gradual. We do not have a number of patients coming every other day. So the healthcare facilities should be able to handle these. Now, number two, if at all you get infected. Now, this is something that's going to happen in every other household. And if we can see, there are so many friends of ours or families where we have these infected patients. So as far as they are diagnosed, they can isolate themselves. It's only the basic medication what is required. There are so many of them who've also not been able to get in touch with physicians, though we like to say physicians are easily available on online consults. So take the expert opinion, follow whatever advice they are giving it to you. So follow those advice, and the advice is not much. It's very similar to any other flu. As far as looking at your O2 oxygen saturation is concerned, I think what we've seen is people are getting extremely, extremely panicky. They are going to various places online, buying those pulse oximeters. People are inquiring about buying those oxygen cylinders. I think if they start doing this proactively, just the sight of those cylinders around is going to further increase the anxiety, and which would rarely be required in these patients. Now, there's a very recent, I think this was from the Institute of Molecular Diseases in Hyderabad. I read this article today. And they say the virus that we have in India, the various strains of virus worldwide that we have in India is a pretty milder form as compared to what Italy saw, what Spain saw. And if we look at the number of people who are actually requiring admission or ICU care is less than 0.5%, I think. And ventilators are required in very, very few of these patients. So most of these patients, once they develop symptoms, there's no reason they should try and run to the hospital. The disease will be there for about 10, 12 days. The symptoms would be there and eventually pass off, hopefully in most people. And as and when the help is required, of course, physicians are there. So step out only once you have a physician from a good hospital who can guide you. Now, the second part of your question, which you had, the residual disease. So if you speak to people worldwide who've had this disease and disease gone away, people are absolutely normal. So there's very little residue which is left over after this disease is gone. So I don't think so anyone has to worry about that would be left with any residual symptoms or aches or joint pains or whatever, which you usually see in so many other viral diseases which we see in India. So that's
Can you have a relapse?
Relapse, we actually no one exactly know whether that's a relapse of the same disease, but there are people who've tested positive after testing negative, even in India. But that's a very, very small figure. Most people who have tested negative and gone back home have continued with their normal lives.
Okay. Dr. Tikku, what is working best in terms of, you don't have a cure, but what are the supporting drugs that are working well, or, in terms of once you are in the hospital, and how far are we from a cure? I've heard all the doing the rounds, all the vaccines and the cures. What have you heard?
See, as far as treatment is concerned, we don't have a specific antiviral treatment as of now. But having said that, we are using drugs, which are basically repurposed drugs, which are used for other diseases. Like we're using antibiotics like azithromycin. We are using hydroxychloroquine. A lot of debate has happened already on that. Yeah, so that is one of the drugs which is being used. And this combination is usually used. Again, it's not to be used for every COVID positive patients. It's for basically moderate to severe disease. Mild patients, I again reiterate, they might not need any specific treatment. They won't need even these drugs. They might need just supportive treatment, which is paracetamol. But there is a subgroup of patients, or if they are moderate to severe, then we can use on a case-to-case basis azithromycin, hydroxychloroquine, ivermectin. These are the drugs which are being used in the hospital, and they are being used also at home with mild patients, moderate patients. Then there are the other high-end drugs. Then there is tocilizumab, which is used in rheumatoid arthritis or autoimmune disorders. It's basically in critical patients who have a cytokine storm. Then we're using convalescent plasma. A lot has been said about that. It's part of the trials in India. So convalescent plasma seems to be very promising. Whatever anecdotal evidence we have till now, most of the patients are doing well on it. But again, trials are going on. So we can't be very sure about it. But yes, seems to be promising. And many other drugs. But these are the main ones which are being used. Steroids are being used in patients with ARDS or who have underlying lung issues. Then again, what I would like to say is that a lot of patients who go on to the ventilator are not doing well. The prognosis is bad. Initially, we thought maybe if we intubate them early, put them on the ventilator, the prognosis is good. But it turned out to be bad. 80% of them could not actually make it. So now we're avoiding ventilation, putting them in prone position, which is head downwards. And that helps them to breathe, opens up the lungs, provide them BiPAP, which is not a ventilator, non-invasive ventilator. And it all helps them to breathe well, and they gradually are getting back. So again, what is important for people to know is that what we have observed, or I have observed, is that people who have moderate disease and they have subtle signs and they've been advised by the doctors to go to the hospital and get admitted, even if they worsen, their condition worsens in the hospital and they land up in the ICU, their prognosis is actually very good. Most of them make it. If you compare it with somebody who's at home, doesn't know his disease is severe or he has those signs where he has to be admitted, is waiting for things to happen, suddenly gets breathless, has chest pain, and then to top it all, he doesn't have a bed and runs around the entire city looking for a bed from one hospital to another. That is where the mortality is happening, and that is what we should be working on. So people who are at home with mild disease, they have to be monitors. As we all said, engage with physicians through video consult, teleconsult, involve those home care services so that the moment your saturation dips, you have those subtle signs, we just pick it up and put you in a hospital. And again, all of us have to work, whether it's government, private, whoever, in getting a bed for that particular patient. Now, if you are not aware and you suddenly have symptoms and you land up in that state in a hospital, none of the hospital should tell you this is not a COVID hospital. You have to go and find a COVID-specific hospital. That's not done. Whether it's government, private, stabilize the patient. Even if it is a non-COVID hospital, stabilize him. Get a bed organized for him, put him in an ambulance, send him to a specific hospital. Again, I would say the problem today is all this transparency in availability of beds. It should be available at the drop of a hat on your phone. You should be able to know before you step out of the house, you should know, I have to go to Max, I have to go to Safdarjung or RML or Gangaram or whichever Medanta, any hospital. So that maybe you do a pre-booking, maybe you pay some amount and book your bed so that you're sure once you're out of your house, you will get a bed. You directly now give them a time frame of 3 hours. Within 3 hours, you land up in the hospital, a bed is for you. Otherwise, after 3 hours, we'll give it to the second. I think there has to be transparency regarding this. We can't keep it as a mystery. Somebody who is COVID positive is at home and needs a bed doesn't really know what to do.
Yeah,
Even if
that adds to the panic. That the fact that you may not even get care, I think, is
Yeah,
the biggest panic.
and we have to take precautions. Now, I'll tell you, people are not taking precautions. They think that it won't happen to them because they're some superhuman beings. If you go out on the road or even in the hospital, both the doctors must have observed they don't wear the mask properly. The mask is below the nose, or it's hanging on the neck, or they keep fiddling with the mask all the time. They don't maintain social distance. Even in the OPD today, I've seen till now 90% of the patients don't maintain social distance at all. Most of them have to be told to wear a mask. And it's not only in the hospital, it's outside the hospital, whether you go for groceries, whether you go to the pharmacy. Nobody has a clue. They seem to be knowing everything, but don't practice it at all. I think
Okay.
because right now, yeah, I'll just one last point on vaccination. I am pretty sure vaccination is not going to be around this year. It will be only the first half of the next year. Lots of more than 100 vaccine candidates are undergoing trials. But again, as of now, we don't know. The trials haven't concluded how much will be the efficacy, safety of those vaccines, how many doses you need. And if you have a vaccine in place, you need 7 billion vaccines. How are you going to manufacture all that? And when is it going to reach the common man in India? So
That's the big question, yeah.
don't
So
be
until then,
dependent on
don't
that.
panic. Live with the
Yeah, take precautions.
precautions. Dr. Bharat, your task is going to be even tougher now because monsoon is coming. So we're going to have a whole lot of diseases like dengue, like, that have COVID type symptoms. But, how are you going to differentiate? What are you looking ahead at?
See, obviously, COVID is not the only disease which is affecting mankind. There are going to be a lot many more. They have been, and they will be, and will continue to be. COVID will probably, hopefully, come and go. But the other diseases like diabetes, like blood pressure, like dengue, like malaria, for that matter, and for all these. So all those other ailments need to also be thought of. It's not that everybody who comes into the hospital has to have COVID disease. These people, the other things and other diseases also really need to have their place in the sun, in the sense that they also need to be looked at and thought of and treated. So my advice would be to everyone, especially people who already are suffering from known diabetes, blood pressure, strokes or heart attacks or heart disease. Do not miss your medication. Continue with your regular checks and balances, and keep maintaining your supervision with your physicians or doctors that you're going to. Do not ignore your basic diseases and your comorbid conditions because there is a corona scare. So look after these think of these other problems. There is a new thing. I mean, I don't know whether this is the right forum to talk about it, but there is a new problem which seems to be occurring. Everyone thought that corona was just a viral pneumonia. It started off with a viral infection, and it affected the lungs, and people stopped breathing, and that's what happened. There is increasing evidence, including postmortem evidence, that it starts off as a lung inflammation, and it actually starts a completely diverse clotting mechanism inside the body, and there are blood clots in the brain, in the eyes, in the heart, in the lungs, in the kidneys, and in the periphery, including in the toes, which is why you heard of what was called a COVID toe. So this is gangrene which is developing as a result of clotting of blood, as a result of the inflammation which is produced by the coronavirus in the lungs. So it's not just a simple viral pneumonia. There is a huge amount of thrombosis or blood clotting that is occurring in the body. And that is also something that I think we as physicians and clinicians are looking after and taking care of. And this is something which is actually complicating the entire treatment. But fortunately, since we now have enough evidence to say that that is what is happening, this is a relatively sort of easy treatment option, because there is established treatment for control of thrombosis, which is already existent and in use, especially in ICU patients.
So the fear that, after COVID, the patient is, after you've been cured of COVID, the question I asked Manish, can you get it again? Can you have another relapse?
Dr.
Parak. No, I asked Manish. Dr. Parak.
Okay. So yes, you can have a relapse, you can have a reinfection, because there is no, I mean, currently the information that we have does not tell us that an episode, one attack or one episode of the infection gives us long-lasting immunity. So maybe that the antibodies which are produced in the body after the first infection, maybe they are not protective enough. We don't know. I mean, that information is still lacking, because there are people who have, as Manish said, tested negative. Tested positive first, then they were treated, they improved, and they became negative. And then subsequently 2-3 months down the line, 2 months down the line, they've again tested positive. So there are relapses or reinfections, we don't know which, but fortunately they are few and far between. It's not the norm. That's not something that is, and hopefully should not happen to most of the people. And usually most of the people would have adequate immunity to be able to withstand another infection or a relapse, whatever it may be.
So Manish, when do you suggest I should go in for a test? When do you think I should panic? I have 100 temperature, throat, bad throat. Some of the symptoms, should I first treat myself at home and then go in for a test? Because tests are also not easy to get. So, and I'm so there are not enough tests doing the rounds also. So when do you think that one should actually go in for the test? Manish.
So, as I said earlier, not all flus that we are going to see is COVID. But in today's time, every time you get fever, it's COVID till proved otherwise. Because everyone is doubting that he or she has COVID or not.
Right.
So number one, once you develop fever or flu-like symptoms, you immediately do not have to run for a test. Because in the early part of the disease, anyways, you will have lots of false negativity of the test. So you get a test that it might be negative, your symptoms continue, you can be positive later. So what is advised is that the first 3 to 4 days of symptoms, do not do anything, just treat it like any other flu, or of course, stay in touch with your physician who will be able to take you through these symptoms. But if you have persistent fever 4 days later, it's always better to get yourself tested, though it's not going to change the line of treatment. Your treatment is going to will continue to be the same, even if you test positive. You have to look for symptoms, newer symptoms that may come in. But what is more important is, if you're positive, you have to isolate. You have to isolate yourself, you have to isolate your family, which has come in your contact, so you can isolate at home. One of the biggest problems what we are seeing, and we are also seeing with healthcare workers in our hospitals who test positive, people who live in small households with many people in the house. So even if the symptoms are mild, they find it difficult to isolate at home. So many of these patients are admitted to hospitals more for isolation than for treatment. So if we are able to pick up people who have been exposed, who can isolate early, who can prevent spread of this disease, I think that's the way forward. More isolation, so this disease process in the public at large becomes extremely slow and gradual. That's when we can handle it.
Okay, thank you so much, all of you. We're totally out of time, but I think the main takeaway from this conversation is that do not panic, and also the survival rate is good, so really do not panic. And there are ways to self-medicate at home, even if the beds do run out. It's not such a situation that every person with COVID has to rush to the hospital bed. But thank you all of you for joining me on this discussion today, and also for educating the public beyond the politics, really the healthcare of COVID. Thank you so much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.